yes. COVID vaccines are safe. They were first evaluated in tens of thousands of people who volunteered to participate in clinical trials. These clinical trials followed the same thorough safety and efficacy standards that the FDA sets for all vaccines in the United States. Since then, millions of people in the United States and around the world have received COVID-19 vaccines, and the results from the U.S. and global safety monitoring efforts are excellent. There are rigorous systems in place to quickly identify any safety concerns and take action. These monitoring systems provide information that allows public health and medical experts to update the recommendations and guidelines as needed to ensure COVID-19 vaccination is safe. When it comes down to it, COVID-19 vaccines are safe and effective. Vaccinations save lives. That's why I chose to be vaccinated and why I recommend COVID-19 vaccination to my patients and my family. Thanks for tuning in. I'm Dr. David Hess. For more information about COVID-19 vaccines or to find a location near you, visit Vaccinate.wv.gov.
Hi, I'm Dr. Catherine Moffat. I'm a physician specializing in pediatric infectious diseases at West Virginia University. My patients and their caregivers sometimes ask me if children and adolescents can have side effects from COVID-19 vaccination. There can be side effects, although not everyone has them. The side effects that children 12 and up can experience are similar to those in adults. These tend to be mild to moderate and include soreness, redness, and swelling around the injection site, tiredness, headache, chills, fever, or nausea. These effects usually last only a few days, and kids may experience some or none of them. These side effects can be a sign that the immune system is building up its natural defenses against COVID-19, but many people build protection without these signs. Similar to adults, these effects are more common after the second dose, yet that second dose is essential for maximum protection. Although these side effects can occur, they are short-lived and outweighed by the benefits of being protected through vaccination. Many cases of COVID-19 among children and teens are mild, but even mild cases in children can lead to long-term health problems. I've cared for children with COVID-19. Some of their cases can be quite severe. In fact, COVID-19 was among the 10 most common causes of death in children in 2020. And COVID-19 hospitalization rates among teens increased in the spring of 2021. COVID-19 vaccination is a safe and effective way to protect our kids against the virus. It protects not only the person who's vaccinated, but those around them as well, especially children who cannot yet get vaccinated. This is why I recommend that my patients ages 12 and older get vaccinated, and I encourage patients, parents, and caregivers to discuss COVID-19 vaccination with a healthcare provider. Thanks for tuning in. I'm Dr. Catherine Moffat. For more information about COVID-19 vaccines, or to find a location near you, visit Vaccinate.wv.gov.
Back to school is almost here. Has your family been vaccinated for COVID-19? West Virginians 12 and older can get vaccinated, and it's the best protection from COVID-19. Protect yourself and your family by getting vaccinated today.
I'm Dr. Jenny Yost, a physician and women's health specialist in West Virginia. I have experience providing gynecologic care to adolescents and young women for over a decade. Are COVID-19 vaccines safe for people who want to have a baby soon or in the future? The answer is yes. COVID-19 vaccines are safe for people who are pregnant, as well as those who may want to become pregnant anytime in the future. There is no evidence that any vaccine, including COVID-19 vaccines, affects people's ability to get pregnant. In fact, leading women's health associations agree that COVID-19 vaccines do not impact fertility. When you get a COVID-19 vaccine, the process of building immunity occurs in the immune system and does not impact the reproductive system. The COVID-19 vaccines have undergone very rigorous safety monitoring. There is no reason to believe that the COVID-19 vaccines will have any impact on the ability to have a baby in the future. So yes, the vaccine is safe for individuals who want to become pregnant in the future. These are just a few reasons why I recommend COVID-19 vaccination to my patients. People who are pregnant or want to get pregnant in the future can choose to get vaccinated. Thanks for tuning in. I'm Dr. Jenny Yost. For more information about COVID-19 vaccines or to find a vaccination location near you, visit Vaccinate.wv.gov.
Hello everyone, it's Monday, August the 9th. We kind of started off there with the mic on mute, but we'll go again now. But I hope everyone's had a good weekend. Regretfully, we lost another 7 people in West Virginia over the weekend. I always want to respect, these people and all their loved ones in every way. I ask for your prayers for them. I ask for your calls to them if you know them and everything. And absolutely, they've given so much. And we've lost these great people, and we've lost their wisdom over all the years and everything that they could continue to give that wisdom to us. And we lost it to this dreaded pandemic and everything that we're dealing with. But nevertheless, if we could, just keep these people in prayer. 7 additional West Virginians, up to 2,972 total deaths in West Virginia now. The 2,666th death was a 91-year-old female from Fayette County. The 2,967th death, a 64-year-old female from Putnam County. The 2,968th death, a 68-year-old male from Cabell County. The 2,969th death, an 80-year-old male from Fayette County. The 2,970th death, a 68-year-old male from Mingo County. The 2,971st death, a 71-year-old male from Marshall County. The 2,972nd death in West Virginia is a 63-year-old male from Nicholas County. I thought about something. I said this earlier, that maybe it was last Friday or whenever, but, if you think 2,972 people have perished in West Virginia, and And you know, it has taken a blow, you know, we have taken a real belly punch to our elderly folks, 65 and older or 60 and older. Every one of these people that have passed away today, you know, that we're reading are 60 and older. But now we've got a different twist, do we not? This Delta variant can jump on our young people. And now we're faced at another crossroads, getting ready to go back to school. And I'll get to all that in just one second. We lost another individual that, a West Virginian that we claimed, you know, and everything, but it's Coach Bobby Bowden. Coach Bowden was 91 years old and passed away, you know, yesterday. And a legend he truly was. You know, he is the second all-time winningest coach in college and Division I history in this country. His 371 victories. While he was at West Virginia, he was 42-26 there, you know, and with a really exciting big win over Pitt. It was a 17-14 win there that we hadn't had in a good little while. You know, but let me tell you something about Coach Bowden. You know, I knew him and knew him very well. He was a Christian through and through. He did many, many things to promote Christianity in this world. He was a gentleman beyond belief, not only a great football coach, but way, way more than that, a great, great, great man. And so I want to tell you just a little bit, you know, when he was here, you know, as our football coach at WVU, his first year that he was the head coach is when the Marshall plane went down. And we lost the entire Marshall football team. Now imagine this. He asked the NCAA permission for his team to wear Marshall jerseys and play Marshall's final game in the 1970 season against Ohio. He was denied. In memory, he had his team, you know, wear a small green crosses and the initials MU on their helmets. He allowed Marshall's new head coach at the time, Jack Lingle, to have his films and playbooks, and Jack Lingle credits Bobby Bowden with helping Marshall's team on the beginning of their recovery. This was a class man, and we'll miss him, and we thank him for all of his contribution to all of us. We'll truly miss this great man. Over the last few days, we have had 1,000, now get this number, 1,037 new positive cases in West Virginia. Our daily positivity rate is at 8.11%. Our cumulative rate has jumped up, it doesn't move very fast, to 4.95. We have now in excess of 4,000 active cases. We have 4,010 active cases, the first time since June the 2nd of 2021. We have 217 people that are hospitalized in West Virginia and 70 in the ICU units. We now have 6 red counties: Marshall, Wetzel, Upshur, Wyoming, McDowell, and Wayne County. We have only 10 counties that are left in the green. We have 45 of our counties that are in the orange, the gold, you know, the yellow, and the red. Dr. Marsh, and I read it right on his face and relayed it to everybody. Dr. Marsh, you know, you could see the concern on his face. That's why we have him as our coronavirus czar. That's why we have the greatness of General Hoyer right with us, and Dr. Amjad, and Secretary Crouch, and all my folks, and all my knowledge. That's why we have us here, to tell you that things are going to get really tough. They're probably going to continue to get tougher in the weeks ahead and everything. This variant comes very quickly, and thank God it leaves pretty quickly. You know, and I wanted to bring this so badly. I forgot it and left it in my briefcase. But USA Today, yesterday, I think, on the front page of USA Today, they had a big map of the entire United States. And through all of that, and I'm going to get somebody to run out there and get that out of my car. It's, you know, get my briefcase and everything, and I'll show it to you before I leave. But nevertheless, it had a big map, and it showed a lot of states that were, for all practical purposes, blanketed in red. And that was the southern states primarily. And as you moved north, you came to Kentucky, which was for all practical purposes all red. Virginia, which was about 2/3 red. And West Virginia there then was about 1/3, maybe 40% red. So even though that below us, all around us, we have populations of states that were all in the red, that really and truly are really struggling. You're still hanging in there, West Virginia, and you're still doing the very, very best you can, you know, but we got to do better. The headlines of the article was just this. Basically, it said, this is the 4th surge, and it could have been prevented. It absolutely could have been stopped. A bunch of people will die. That's all there is to it. We could have stopped this. Now, we have got to continue to push in every way to get more and more folks vaccinated. And if you're 65 and above and you have any symptom at all, you've got to get tested. The antibodies will probably save your life. And you don't want to mess around with this Delta variant because it absolutely is tough. Dr. Marsh, the last go-round, reported that 91% of the new cases are the Delta variant in West Virginia. It's tough. It's everywhere. I told my wife this yesterday. Yesterday, you know, I was telling her about some people that came up to talk to me, and they knew they hadn't been vaccinated, you know, and everything. And Kathy said, well, why would they do that and everything? And I said, because Kathy, and let me have it. I said, Kathy, it's all around us everywhere. Here's the USA Today article on the front page. And what it says right here is it says, we are failing one another. And then it says, this is America's 4th COVID surge. It didn't have to happen. Let's end it now. And then it shows West Virginia right here. And if you'll look real closely and everything, but West Virginia right there is partially red, a little teeny streak that runs from maybe the central part of the state down in the southern part, and there's a big glob of it that is right around the Grant and Pocahontas counties, and a little bit up in the northern panhandle. But other than that, we continue to do a pretty decent job. But just look below us. Kentucky right here, all red. Virginia right here is about 60% red. Tennessee, all red. North Carolina, all red. South Carolina, all red. Georgia, all red. Florida, all red. Alabama, all red. Mississippi, all red. Absolutely, absolutely. You're hanging in there, West Virginia. You're hanging in there pretty good. We continue to get our people vaccinated. We just get better and better and better. I want to tell you again about wearing your face coverings and everything. If you're 65 and older and you have all kinds of issues and everything, absolutely you ought to really consider wearing face coverings in crowds and everything. And to try to avoid this, I started to just tell you this. I've got to tell you this. This was what I was telling my wife. I said, Kathy, do you not realize that this Delta variant is everywhere? It's not a few places, it's everywhere. It's all around us right now. Now, if you're fortunate enough and you're taking a and I can't say it anyway but this, you're taking a hell of a risk if you're not vaccinated. That's all there is to it. And you're doing the same with our children and everything else. You are taking a hell of a risk. Because if it is as infectious as what our coronavirus is telling us, then it's everywhere. And if it's everywhere and you take that level of risk, the only thing in the world that is protecting our children or you as an adult, or Kathy, my wife, or myself. I said, Kathy, do you not realize that this is everywhere? Everywhere you go, you know, if you're in any kind of crowd of people, a third of those people have not been vaccinated. Well, she couldn't believe it. She couldn't believe that a third of the people wouldn't be vaccinated. I said, Kathy, it's true. And it may even be more in certain places, but a third of those folks aren't vaccinated. So, Kathy, the only thing that is protecting you, the only thing in the world that's protecting you is your vaccination. Now, that's it. That's plain it. And this stuff, absolutely, as we get a colder season that comes, and as we get back to school, football games, state fairs, all that stuff, do you not think that this thing is not going to rear its ugly head even more so than it is now? Now, you're doing a decent job, West Virginia, as far as getting vaccinated right today. And I'll get to that in just one second. But you got to do better. You just got to do better. The vaccine's effectiveness, we've been through that a bunch of times. I want to make one announcement real quick here, but I'm going to read some of this to you. But on Saturday at the West Virginia Coal Association's meeting, their annual conference and everything, I announced that I am officially reactivating the West Virginia Public Energy Authority. The WVPEA was created by the legislature with a mission to foster and encourage and promote mineral development, the mineral development industry in West Virginia. One thing we want to ensure is that West Virginians will continue to be an energy powerhouse for the entire world. By reactivating the WVPEA, the state will maintain real-time, first-hand knowledge of the status of each power plant, their life cycle, and whether there are concerns of household power supplies being disrupted. The WVPEA will also coordinate the output of merchant plants with capacity needs of the regulated plants. Additionally, the authority will assist in developing the next generation of coal-fired power plants and a long-term energy policies that will be good for our West Virginia resources. As part of the reactivation, I have appointed these people. I've appointed all new membership to the WVEA, including Jeff Allen, Charlie Bird, Chris Hamilton, and Jeff Herholt. In the country today, again, whether it be coal, oil, or gas, our energy industry is under attack. Now, I've said this and I've said it over and over. We want to embrace all the renewables, do we not? We don't want to kick them to the sidelines and be narrow-minded. We want to embrace our renewables. We want pristine air, perfect waters and everything. We want to embrace our renewables. But anybody that believes that today in America, today in the world, we can just decide, oh, well, let's just get rid of coal, let's get rid of oil and gas, let's get rid of those coal miners or those gas workers, let's get rid of them. We don't need them. It is an absolute frivolous thought. Today, if we were to do that, we will have more disruptions than you can possibly imagine. And we cannot possibly do that. The last thing I'd say on this is just this. The world is crying out for energy today. The world continues to cry out. Do you not believe that America is going to cry the same cries? Absolutely. That's why today that the thermal coals, of which my family's companies, and I want to underline this wholeheartedly, we don't mine any thermal coals. I don't have a dog in this hunt. So don't anyone accuse me of having a dog in this hunt. I don't have a dog in this hunt. Absolutely, from the standpoint of our family, we mine metallurgical coal. It makes steel. But with all of that, I want to tell you just this. As the world cries, as the world continues to cry, and America too, for more and more of a demand on electricity, today, the demand mongrel is out of the house, and it can't be controlled. Really and truly, supply rules the day almost 99% of the time in this industry. But today, and when that demand mongrel comes out, and there's a real demand for him, it is really, really, really tough to keep up with the demand. So that's why our coal producers today and our gas producers today are doing very well. And we hope and pray they'll continue to do that. I've said there is nothing that will replace one coal job. It is really, really, really important. And so we want to continue to try to foster and be proud of our natural resources in the state of West Virginia, and know without any question, if you believe this world can today do without coal or do without gas, then we don't need to have a conversation, because I think that's completely silly. Someday, maybe. Someday in the decades ahead, maybe. We want to continue to embrace our renewables and go forward as best we possibly can. But today, absolutely, we need our coal and our gas in the worst way. So I am really proud to reactivate this board and this energy authority, and they will help lead us in lots of ways, in lots and lots of ways. So the one thing we surely need to be positive of is we need to do everything in our power to protect our baseload energy capacities, and that's what this Energy Authority Board will do in every way. The vaccine distribution update and everything, I'm going to jump back to that and just talk to you just 1 second about this. Over the weekend, since last Friday, we gave 9,000 doses. That's really good, really, really good. We are up now to a grand total of well in excess of 1 million. I think it's 1 million. It should be somewhere approaching 1,080,000. I think that's real close. And we are at 89.8% on our 65 and olders. We're at 83% of our 50 and olders. We're at 69.1%. I love this, of the 12 and olders. And if we can get up in the 70s, that would be wonderful. Really, really good stuff. I want to talk to you about just this, I'll keep on going here. I'll go to this right now. There was an article that just ran in the Beckley paper, and I hope the Beckley paper will pay real close attention to this and everything, and just and keep the garbage, especially off the front page if they can. And I wonder if they'll make these corrections and everything. But now just think about it. Since we started the Do It for Baby Dog campaign, and we were starting to lag just a little bit right when we did that. I didn't realize this, but our people have brought this together. We were slightly above, now get this number, we were slightly above 800,000 people, I guess, that have gotten their first shot when we started. No, I take that back. We were slightly above, we were right on the money at 900,000 people. If you'll look at the blue line is when it was announced that we were moving, from ages 16 and above down to 12 and above. And that was, and if I'm reading this correctly, that was somewhere in the latter part of May. And then that was maybe around May the 10th. And then somewhere around, it looks like about May the 20th, is when we started the Do It for Baby Dog campaign. Okay, at that time, we had right at 900,000 people that were vaccinated. And today, we've got 180,000 folks that are, I'm sorry, 1,080,000 folks that have been vaccinated. That delta difference, that difference from when we started to today is 180,000 people. If I'm doing the math correctly, it's 180,000 people that we have gotten a first shot, you know, and if that be true, if that number is exactly right, and I haven't verified these numbers myself, but this came from our GIAFT or TF, you know, this came from our task force numbers and everything, and this is exactly the numbers that they've given me. But if this be the case, we have vaccinated the first round shots on people, 180,000 people since we started to do it for Baby Dog campaign. I don't know how in the world we could say anything other than tremendous campaign, very, very, very successful. And I'm tickled to death because of those 180,000, how many lives have we saved? How many? How many have we saved? And what are they worth? You know, both those are really hard and intangible, but we sure saved a bunch of lives. And so I think we sure spent a few bucks, and we spent a few bucks. It was the federal government's money, and we spent a few bucks in really a good way. On vaccine eligibility is 12 and above. I encourage you to get your second shot. I really call upon the grandmas and granddads especially, but parents as well, to get your kids vaccinated. Get those kids that are getting ready to go to school vaccinated. I mean, it is the greatest protection that they could possibly have. Get them vaccinated now. And please run to the fire and get them vaccinated. The COVID information's all up there. I've kind of been through the Baby Dog sweepstakes. Tomorrow is the last day. Our last day, unless we come up with another marketing plan and everything, but tomorrow is the last day. There's 385,000 plus that are registered and everything, and in the drawing, we're going to give away a whole lot of cash prizes, cash money tomorrow. We're going to give away $1,588,000. We're going to give away $588,000 as the second place. We're going to give away the trucks and the park getaways and the lifetime hunting and fishing license and the guns, the hunting rifles and the shotguns, and we're going to give away 2 more 4-year full scholarships to our kids, and that's the one that I love the most of them all. So stay tuned, tomorrow, and if you see me show up with Baby Dog, you'll know something's up. So nevertheless, I can't be more excited about the fact that we're really starting to especially move in getting people vaccinated, and that's really, really important. I encourage you to take advantage of the free testing. I thank Frith and I thank Walgreens over and over for all that they've done. And if you have any symptom at all, please take advantage. Take advantage of that free testing while it's here. We have 14 outbreaks in 6 facilities. That's up 6 from Monday. We have 11 outbreaks in our churches in 10 counties: Cabell, Fayette, Jackson, Jefferson, Mason, Marion, McDowell, Nicholas, Putnam, and Raleigh counties. We have 30 inmates and 4 staff people that have COVID right now. And I encourage you over and over about giving blood. But sorry we had a bunch of stuff. I ask for your prayers for Coach Bowden and all these people, and just that's all I got right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. As the governor has said, that getting vaccinated, fully vaccinated, is really our principal intervention, our principal power against this Delta variant. An interesting story came out over the weekend that said that there was 5 numbers that really give us insights into this pandemic. And the first one is that we have seen a 9-fold increase, 9 times more average daily cases in less than a month, given the impact of the Delta variant. And over the weekend, we had an average daily new case positivity rate of or a number of 107,000 new Americans on per day, average over the last 7 days. Second number is we have more Americans hospitalized since February, and we have seen a rapid increase. The governor read the numbers for us, and in fact, we just received a report from the Hospital Association that says that perhaps an even more current number is that we have 269 people who are infected with COVID in West Virginia hospitals, of which 101 of those people in the ICU and 45 of those people are on mechanical ventilators. Third number is we've seen an 84% increase in the number of children and infants who have been hospitalized for COVID-19 in the past week. And we have seen, I believe, over 40,000 people be admitted to American hospitals who are younger. And we've talked about the fact that this particular variant is much, much more highly infectious and can infect at the rate of chickenpox. So we know that maintaining mitigation measures are still important, but perhaps not as absolute effective as was true with the last virus that we have seen, which was the Alpha variant, which started in the United Kingdom, or the initial variant of COVID-19. And according to the CDC, mask wearing is 40 to 60% effective in reducing the concentrations of the Delta variant in a mixed group, and about 20% or so to 40% effective in protecting you. So certainly consideration of mask wearing, particularly indoors and particularly around people that you don't know. And if you're not vaccinated, that is absolutely the recommendation of the CDC. But even if you are vaccinated, it could make sense to do that. Third number is that 93% of the cases of the Delta variant are 93% of the cases of COVID-19 in the US are from the Delta variant. And as the governor said, 91% of our recent assessment using next generation sequencing to identify the cause of the virus showed us that the Delta variant is the dominant form. The fourth issue is that we know that people that are fully vaccinated have a much, much, much better outcome from the Delta variant, both in the reduction of the risk of catching it, but importantly, the reduction of the risk of getting severely ill, hospitalized, or being in the ICU. And the last number, which the governor touched on, is that at this time, we are seeing increases in vaccination rates around the country. And as the governor said, with the baby dog lottery, many West Virginians decided to use that as an incentive to protect themselves and protect each other. But we hope that even more West Virginians continue to get vaccinated, particularly our younger West Virginians, because we've seen the number of active cases go up by over 1,000 since the last press brief. And that we know that the cases are relatively evenly distributed among many, many age groups, 20 to 29 being the largest, but really most age groups up to 65 and over have substantial evidence of spread. And we don't know when we could express the Delta variant. As we've said, the Delta variant increases the amount of virus that's shed earlier, maybe as quick as 24 hours after being infected. People, even if they're asymptomatic, can spread to others. It seems to peak around 4 days, which the other variants peaked around 6 days. So it's really important for people, as the governor said, if you have any symptoms, please get tested, because we want to be able to identify the people that are infected and try to keep them from infecting others in their social networks, because this guy spreads so rapidly that if we can start to identify people at that point of contact, then that would be obviously better. And as we look around the world, we have seen, as we said before, that this variant tends to be explosive in its onset and tends to peak and then come back down. And when we start to look at, does the United States and does West Virginians curve, the slope of the number of cases and hospitalizations resemble more India, where we saw rapid increase in cases, rapid increase in hospitalizations, and rapid increase of deaths, or more like the United Kingdom, which was a fast rate of new cases, but a much slower rate of hospitalizations and very relatively small impact on death, which is a much more vaccinated country. And unfortunately, our upswing is at this point much greater than the United Kingdom's. And so while we are certainly better vaccinated than India, and we would anticipate that we wouldn't have that severe an outcome, we see that the slope of our hospitalizations is going up pretty rapidly in our country and also in our state. So that really does suggest that we should be on the lookout for more severe consequences of our population and perhaps a bit more of a prolonged sort of upslope and before we get to the downslope, which makes it even more important right now for people to protect themselves. And please, 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 right now choose to get full vaccination, because even if you aren't going to absolutely be protected fully during this immediate phase of the pandemic, as the governor read from USA Today, we anticipate that this may not be the last peak of the pandemic, given the number of unvaccinated people we have both in the US and around the world. And so we want to protect our citizens, we want to protect each other, want to protect our state and beyond. And it is really, the ability of each citizen to run to the fire in that way, which means get full vaccination. Thank you.
All right, thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. As the governor pointed out, we had a positive weekend with over 9,000 vaccines administered. To date, 60% of our total population has at least one dose, 69% of our eligible population. And while those numbers are positive and the numbers this weekend are positive, West Virginia, they are just not fast enough to keep up with the Delta variant and what may be coming behind it. So what the governor continues to try to impress upon us, Dr. Marsh, Dr. Amjad, Secretary Crouch, is we have got to pick up the speed with which we are getting vaccinated in our state. It's exceptionally important. And in order to reinforce that, I'd like Jordan to put up a chart that we worked with the West Virginia Hospital Association. I thank Hallie Morgan and Jim Krantz for this effort and the work. If you look at the blue line, at the height of our initial major surge, 826 COVID cases in the hospital. Now look at the orange line, where we are today. And as Dr. Marsh pointed out, even since the dashboard came out this morning, the Hospital Association updated their numbers, 269. Look at the trend line. We are going to put West Virginia, we're putting our healthcare workers, our hospitals in an exceptionally difficult position if we don't pick up the pace of vaccination. As Dr. Marsh has pointed out, we know that you have to have 2 doses and be 14 days past those 2 doses to have a full and significant impact of reducing hospitalizations and reducing death rates. West Virginia, we have got to move out fast. We've got to get on this. We've got to get vaccinated. Thank you.
Thank you, sir. Next to Dr. Ayn Amjad, our State Health Officer.
Good morning. Just for a little update about our vaccine breakthrough cases, we have a total of 883 cases in the state, which only accounts for about 0.1% of our total cases. And of that, about 14% of those are hospitalized. and that accounts for only about 1.3% of our deaths. That just wants to go into what the governor stated earlier about how important getting vaccinated is. And we do want to remind people that we do have vaccines in the state, also at the pharmacies, and also to remind people to get tested. We still have a lot of free testing events around the state, and if you have any symptoms, to get tested. Thank you.
Thank you, Dr. Amjad. And finally, to Secretary Bill Crouch with the DHHR.
Good morning, everyone. As a reminder, free testing continues to be available through local health departments and community testing events. If you or a family member have symptoms of COVID-19, it is critically important that you be tested. We encourage you to take advantage of these free testing events to protect yourself, your family, and your neighbors. Information about testing locations and dates can be found on the free testing tab at the Coronavirus.wv.gov. Thank you.
Thank you, sir. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking a moment for my question. As I understand it, West Virginia schools are planning to mandate masks for K through 5, and then once you get to middle school and high school, it gets different depending on the district, et cetera. I was pointing out that there are more than a few sixth graders who are not 12 years old yet, so they are not eligible, of course, to receive the vaccine as of today. So has any thought been given to look at those sixth graders and those that are not 12 years of age, that the 11-year-old group would be mandated to wear masks? I know we're kind of getting into the splitting hairs part here and getting into the weeds a little bit, but some parents have expressed some concern that since they aren't eligible to get the vaccine, perhaps they should be required to wear masks, not based on grade, but their age group. Thank you.
Kenny, everybody's got to understand, that we're monitoring nonstop, and we're going to try as best we can to go and let the locals, deal with this from the standpoint of on a county by county level. But I've got to say this, and I'll probably say it again in the closing remarks too, but here's what I would say to people. I would say, everybody, full stop. Full stop. I mean, that's all there is to it. Now listen, if you've not been vaccinated, just think about this. We're on a collision course here that if we absolutely continue down the path that we're going, we may very well get in a situation, and God knows I don't want to do this. I do not want to do this, but how are we going to feel like if we end up with our kids or whomever it may be that we have to go back to some level of mask mandate? What are we going to do if we really get in a situation to where we have to have mandates on state workers or whatever it may be, teachers, whatever, to make absolute certain, or businesses, to make absolutely certain that businesses come out and start coming out and saying, you can't work here unless you're vaccinated. Absolutely do we want to cross the bridges to where we're going to have to absolutely look at masks, or are we absolutely going to look at mandates, or are we going to risk more and more and more people dying? I am telling you, I would step back and I would say, full stop. Even if whatever reason I may have, that I may think, well, I don't want to get vaccinated. From a safety standpoint and a health standpoint, first and foremost, if it's okay, then you may have to, for the better good of everyone, for the better good of everyone around you, please consider getting that done. And from the standpoint of where we are right now, we may not be able, in fact, we're not going to be able to stop this surge that is with us right now. From a standpoint of can we stop it for West Virginia, you're not going to be able to. Can we absolutely individually make ourselves 1,000 times better off from the standpoint, and I'm just using a number to make an illustration. But absolutely, if you get vaccinated today it will ensure you at least to some degree of safety. And the longer it goes, the more safety you will have. I don't know why in the world we would not run our kids to get our kids vaccinated. And I don't know why in the world, if you're not vaccinated yourself, you wouldn't be running today, right this moment, to get vaccinated with all this information that's out there in front of you. So Kenny, from the standpoint of doing our 12-year-olds or not 12-year-olds, but doing our 6th graders and everything, sure, Kenny, we're going to look at it. We're going to stay on top of it. We're going to try to do it county by county and everything, but thank goodness right this moment, I am not in a position that I feel like we need to mandate anything as far as toward our businesses, towards our state employees, towards wearing masks. You know, I'm not there, but absolutely if we don't watch, this is absolutely staring us right in the face. All these things that we don't want in any way, it's staring us right in the face. We can stop it. What did it say? We're failing one another. You know, we're failing one another, not getting vaccinated. And then it says clearly here, this is our 4th surge, and it didn't have to happen. It didn't have to happen if we would have just gotten vaccinated. Come on, we got to do it. And General Hoyer, can you not see the passion in his voice? We got 9,000 people vaccinated over the weekend, and he's absolutely looking right at us. And literally, if you could see that man behind closed doors, I mean, that man would not say nice words. But that man right there has been a leader for this state beyond belief. He's been a leader for the nation, a leader for the world. Absolutely, that man is screaming at us, 9,000 is not enough. We got to move, and we got to move right now. I hate to be on a soapbox, but it's just too important. We don't want kids to be sick. We do not absolutely want to lose people right and left in West Virginia. Absolutely, we've done too good. We've got to get across the finish line.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for Dr. Marsh. Dr. Marsh, you described this pattern that we're expecting to see, this rise, this peak, this fall. Could you give us a more specific prediction as to when you think West Virginia will experience that peak, given the rapid increase that we've seen in recent days? When do you think we're looking at the peak? Thank you.
Dr. Marsh, please.
Okay. Thank you, Governor. Thank you, Charles. You know, I would hesitate to make any guesses given how unpredictable this pandemic has been. But what we do know, Charles, is that in the country of India, which is was at least, and still is in many parts, a relatively low vaccinated country, that this Delta variant had an upswing that went about 10 to 12 weeks or so, and then rapidly went down. And from that, hospitals were overwhelmed in India. They lost officially 400,000 people, that some people say maybe multiples of that in reality because of the difficulty in counting effectively. And remember, India is where family members had to go out and try to find sources of oxygen for their family members who were being considered for hospitalization. And then we look at the United Kingdom, that is a much, much, much better vaccinated country, one of the best vaccinated countries in the world, starting with their older population and coming down. And what they found was that their peak upswing was about 6 weeks or so. And then they had a lot of cases, fewer hospitalizations, and very few deaths. And that was really what Israel had seen as well. Although there is now that the cases have come down, they have seen a little bit more death and hospitalization. So some of those data may be a bit of a lagging indicator, but much different than India. If you look at the slope of our curve, both in the cases and the hospitalizations. Our upswing, as General Hoyer told us, was actually much more acute. So that makes me at least think that we may be more in the kind of in-between area. So therefore, I would guess that perhaps, in the next few weeks, we will see a continued rapid upswing and perhaps peaking, somewhere between the 10 to 12 weeks that India saw and the 6 weeks or so that the UK saw. The real concern, of course, as the governor has said, is we still have a part of our population, certainly, that is not vaccinated and extremely vulnerable to the impact of the Delta variant of COVID-19, but also the single most concerning medical illness or medical condition that makes the severity worse from any form variant of COVID-19, except for age, immunocompromised status, is obesity. Being overweight, being obese, and being medically obese. And West Virginia is one of the most obese states in the country. And we have a lot of coexisting medical illness, which puts our population at much higher risk, as we've talked about. And we have an older population, many of whom have been vaccinated at the beginning of the pandemic, so 6 months or more after their vaccine. So we're worried about residual immune function, even in some of the folks that have been vaccinated, which is why we're doing the booster battlefield assessment on that population, but also certainly on our unvaccinated population, and particularly our unvaccinated population who has coexisting medical conditions like obesity.
To me, just 1 second. Charles, where Dr. Marsh is speaking very intellectually to you and everything, I can, I just speak like I'm in your kitchen talking to you. But Charles, just think about this. Think about in India what happened. Think about, and that all of a sudden it starts running through the people so fast and so violently and everything. There's got to be decisions made because hospitals are so overwhelmed and there's no oxygen, capacities and everything. Decisions are being made. You, and you have to die. I'm going to try to save this person over here. And we believe, have we not? We believe, well, that's not going to happen to us. Not in the United States. That's not going to happen to us. Would you have believed in West Virginia a couple of years ago, if I were to have come out and said, we're going to lose 2,972 people in a pandemic in the state of West Virginia and maybe lots and lots more? Would you have believed, oh, that can't come to the United States. That can't happen to us. Well, it can. It just plain can. That's what Dr. Marsh is trying to help us with. That's what I'm trying to help us with. General Hoyer's trying to help us with. Dr. Amjad, Secretary Crouch, on and on and on. That's what we're trying to stop and trying to help us with. We can do it. We can do it so simply if we just get ourselves vaccinated, especially really work on our kids, but all of us need to get vaccinated.
All right, thank you, Charles. Next to Annie Moore with WVVA.
Good afternoon, Governor. We're getting word of 2 outbreaks at the Hilltop Nursing Home in Fayette County with 50-plus cases, and Stonerise in Beckley. Are any of these cases breakthrough cases, or are they simply unvaccinated individuals?
Secretary Crouch or Dr. Amjad, you got to take this.
Hi, Annie. We're still getting word on some of those cases, so we'll have to get some more information, but a lot of them are some vaccine breakthrough cases because a lot of our long-term care facilities were vaccinated, but we'll have to get some more data and information to see how much of those are vaccine breakthrough cases and how many of those are new cases if there's staff and other information for that. But we'll get those details to you later on today if we get that from our epidemiology staff.
Yeah, thank you. This is Bill. If I could just add, our staff's been working for about a week and a half, 2 weeks now, trying to automate the breakthrough piece of our dashboard. So We anticipate this week being able to push out information almost live. We think we can get about 95% of the breakthrough cases on the dashboard as they come through the system. So we'll have more information on that Wednesday, but hopefully provide you that information every day on the dashboard. Thank you.
Great, thank you, Andy. Next to Paul Mullen with WCBC.
Morning, Governor. Good morning, panel. Question number one would be about a quarantine recommendation for people who travel to hotspots. Governor, you showed us the map from USA Today with all those red areas to the south of West Virginia. Have you given that consideration? And if you have not, why not? And the second question goes to General Hoyer, and that would be about the hospital capacity. Early on, that was the big concern, that we wouldn't have enough room in the hospitals for people getting sick. Given the speed of the virus and those numbers that you just referred to, is that concern back with us now? Thank you.
Well, Paul, I'll defer to General Hoyer on the second, aspect of it. But we've continued to do assessments of just that, all the capabilities and the supplies and everything that we have. But Paul, I mean, if you'll look at this map, and you'll start right here, at Indiana and Illinois. They're not completely red, but they're close. But when you go absolutely from there all the way south, everywhere is, for all practical purposes, red. And so, you've got a big block out in the west, in the central part of the state, whether it be the Dakotas or Nebraska and stuff, you've got red areas, but you're not completely covered up. And then, it's amazing, but in the Northeast, it's not too terribly bad. But Paul, right now, I don't see how that we could, putting on travel restrictions and everything. There's so many places that this is really tough. I just don't see how that would work. But General, maybe you can take the tail end of the thing. The only thing that makes good sense out of this whole thing is just get yourself vaccinated. General?
Yes, sir, Governor. Paul, you are correct. Reason we showed the slide today is the concerns that we have. We have continued or instituted again more regular conversations between Secretary Crouch, Dr. Amjad, Dr. Marsh, and myself with the Hospital Association. And remember, too, it's not just about the number of cases that are COVID cases in the hospitals and capacity there. This also then impacts the ability to care for other illnesses that occur, as well as elective treatments that are important to people going forward. So we do have concern. We're watching it. We'll continue to do trend analysis. And one of the good things is that our hospitals across the state of West Virginia, through the Hospital Association, work exceptionally well together and cooperatively to balance load when they need to. Thank you.
All right, thank you, Paul. Next to Mark Curtis with Nexstar Media.
I'm going to throw some numbers out here. The one thing I look at is the number of people fully vaccinated of those eligible 12 plus. Right now, that number stands at 57% of that age group, 12 plus, is fully vaccinated, meaning 43% are not. Then you say 180,000 people signed up or got vaccinated after the Do It for Baby Dog campaign was launched. That appears to be a big success. And so I'm wondering why the program is coming to an end. What I'm wondering is, can you retool the lottery drawings and focus down in the younger age groups prizes they might be more inclined to want if they get vaccinated? I think, replacing the pickup trucks with Mustangs, perhaps doubling the number of college scholarships, throwing in Nintendo gaming devices and other things that appeal to those people, particularly ages 12 to 29, to incentivize them to come out and get vaccinated so they'd be eligible for prizes that probably are more geared to them.
Mark, it's good stuff to me. Now there's people that'll sit around and throw stones and say, well, why are you doing that and everything? But just look at why. The why is really simple. That little bulldog came along and everything and made a lot of people smile. And then with the work with the lottery and everything, we put these prizes at play, and surely to goodness, where we paused almost around 900,000, we really climbed. Mark, I would say to you just this too, that, and I want to make sure that I've got it right here, so just hold it just a second. But we are at 57% fully vaccinated. That's first and second shots. But we absolutely, at the same time, we've got 69% of our total population, 69% of our total population with one shot. And surely to God above, if they got the one shot, they're on the way to getting themselves fully vaccinated. Mark, you make good points. I listen, and we'll absolutely continue to look and take into consideration your thoughts about, maybe changing the prize list and targeting the younger people and really trying to aggressively get after that. We do have a thing that we just launched, with Clayton Birch and everything with the schools, the $50,000 deal where schools are competing and they're going to get, I don't know, there's 12 or plus number of private and public schools that are going to get $50,000 when their school, comes out with the higher vaccination rate than their competition around them. But we're constantly, everybody is constantly looking for ways to make it better. I'll surely take into consideration what you just came up with because it's good thought.
All right, thank you, Mark. Next is Steve Adams with Ogden Newspapers.
Hey, Steve Adams of Ogden Newspapers here. Question about the Public Energy Authority, real quick. I had noticed, I was looking at the appointees, and this is something that Governor Manchin didn't do either, it looks like, doing some research. But I know that part of the requirements in state code is one of the people that's supposed to be appointed as far as the 4 public members is supposed to be somebody, a person with significant experience in advocacy for environmental protection. Offhand, I didn't see where any of the new 4 have that. I know obviously Jeff Holt used to be the Division of Energy executive director. So in that capacity, he certainly had advocated for more things other than coal and natural gas, such as wind power and things of that nature. So there's some question between that and the Bill Rainey appointment by people that are in the environmental field to kind of feel that the finger's been kind of pushed too hard on the scale in favor of obviously coal and natural gas. So I didn't know what you might say to some of the critics that kind of want to see at least one environmental advocate included as part of that new group. Thank you.
Stephen, I don't have all those that are in the new group. I mean, I announced the ones that I went through today. I don't know if that's the entirety of the board, but I am always an advocate of exactly what you said. I think fair representation is there. From the standpoint of an environmental, a person that's more leaning towards the environmental side and everything is always good. It's always good to have that information bounced at different folks and everything. But I would say just this, and here's all there is to it. These people are good people. They're rational thinkers. They're not one-sided thinking people and everything. And the biggest thing that I think we've got to absolutely always do in West Virginia is we should be really proud of who we are. I mean, for crying out loud, I said this, I said it a long, long time before I ever had a thought of running for governor, decades before. But I said it just like this. I said, you could travel to Iowa City, Iowa, and this was back in the 1990s. But you could travel to Iowa City, Iowa right now, And you could walk the streets in Iowa City, Iowa, and talk about, corn farmers. And absolutely, the pride is astronomical. You could absolutely, at the time in the 1990s, I said you could travel to Houston, Texas, and you could talk about the oil workers. And the pride was off the chart. And in the state of West Virginia, of all places, we should be really proud of our coal miners and our gas workers in every way. We should be so proud in everything. And we should try to perpetuate their industry while at the same time, and I have done this, you can't deny this in any way, we have diversified this economy, and this economy is racing forward. We are absolutely booming in tourism and high tech and all kinds of different things. We are moving in West Virginia, really moving in a diversified way, but I am a real believer we should be really proud of who we are. And in West Virginia, thank God, we're a natural resource state and we abound in that. And absolutely, we need to always protect and perpetuate that. And so, the bottom line, the whole thing is, what an advocate I've been of tourism. And when it boils right down to it, if you were the advocate that I've been for tourism, do we not have to have pristine environment and waters to have great tourism? We do. And I don't want anything but that. But I absolutely don't want us to turn our back on two great industries, whether it be coal or natural gas, that can absolutely do greatness for West Virginia for decades to come, in my opinion.
All right, thank you, Steve. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody. Governor, or whoever wants to answer, some of these new numbers are pretty eye-popping. 1,000 new active cases out of 4,000. So a quarter are new. I'm wondering if that is a result of a surge or a result of the schedule for keeping track of these numbers. Also, I think someone, maybe Dr. Marsh, said 84% increase in illnesses among children and infants. I'd like a little more context about that too. Thank you.
Okay, Brad, I think, Dr. Marsh is probably best to answer this, but, Brad, I'll just say it again. Just think about this, Brad. 269 are in the hospital right now. 101 are in the ICU units. We're over 4,000 active cases, something that we got below 1,000. Just a few days back, we were below 1,000. We're at 4,000 now. We're 4 times to where we were a month and a half ago or 2 months ago. 4 times, where we were a couple of months ago. Absolutely, the number in the hospitals dropped down, I think, I don't know if we've got in the 50s, but, 60s and 70s. We're at 269. We're 4 times or 4.5 times where we were at that point in time. We're 4 times the active cases where we were then. We know that 91% of the new cases are coming to us. The new COVID cases are the percentage that is the Delta variant is just more and more and higher and higher. And we know how infectious it is. I mean, Brad, it doesn't take a rocket scientist to look at this and just say, what are we doing? What are we doing to ourselves? I mean, no matter how you feel about getting vaccinated or not vaccinated, what are we doing to our neighbors? What are we doing to one another? We're going back to school. It's getting ready to get cold again. Absolutely, this stuff has a chance, and I don't want to ever be an alarmist, but it has a chance of getting really bad, really bad. It got really bad for 7 folks over the weekend for sure. And we know just how many more we could lose. Dr. Marsh, if you've got anything to add, please do.
Thank you, Governor. I just looked up on the website in early July, which is about a month ago, we had 52 people in the hospital from COVID. We had 17 people in the ICU from COVID, and we had 6 people on ventilators. Today, that 52 number has gone to 269. That 17 ICU number has gone to 101, and that 6 ventilator number has gone to 45, and we're growing. This is what the Delta variant does because it spreads so rapidly. And Brad, to answer the second part of your question, the 84% increase is in children and infants across the country. And I quoted a number over 40,000. It's actually 72,000 new admissions for children and infants over the last week in America, including 143 admissions in Florida, or 143 hospitalizations for children and infants in Florida, 140 in Texas, a story about one 9-month-old infant that had to be flown over 100 miles in Texas to find a pediatric bed because of a problem that they were having. So this is what the Delta variant does. And I think that, as the governor has said, and we have said many, many times, this is really the reason why we need people to be fully vaccinated, both to protect themselves and their families right now. But the COVID virus will continue to mutate until we get more of the world's population, which is currently about or less than 10%. So we know in Africa, say, for instance, the Delta variant is growing rapidly, causing many problems. They have the highest case fatality rate, I believe, right now on the planet. And this is a place where the Delta variant may get stronger and more fit as it comes out of places like Africa or Indonesia or other places that are having lots of problems, where you have a lot of people and low numbers of people vaccinated. And that is true for part of our country as well. So unfortunately, this is exactly what we have been afraid of and what we've seen happen around other places in the country and in the world that have irregular vaccination numbers. And the most vulnerable people are the ones that are at the highest risk of severe consequences of this, as we're seeing from all the numbers we talked about earlier.
All right, thanks, Brad. Next to Kelsey Soto with WSAZ.
Good morning, Kelsey Soto, WSAZ. This is probably for Dr. Marsh or retired General Hoyer. You guys have been in talks with the Hospital Association. I'm wondering if you can kind of speak about some of the conversations they've been having and efforts going on right now to protect our resources. I know in Kentucky, some of the hospitals here are requiring their staff get vaccines. Because obviously we're not sure exactly when we'll peak. And even if more people get vaccinated, it's going to take time for those to go into effect. And so obviously at the beginning of the pandemic, there was a concern about having enough resources and ventilators and stuff like that. So maybe just an update on where we stand with things and how that's looking.
General, please.
Yeah, Kelsey. So again, as I pointed out earlier, Secretary Crouch, Dr. Marsh, Dr. Amjad, myself, other team members from DHHR and our task force are continuing now to have much more regular discussions with the Hospital Association and participating members. They are actively working across and have the Hospital Association has been a part of our joint interagency task force from the beginning of this pandemic. So continuing to look at PPE availability, at equipment, discussions about types of equipment as the variant changes the age groups. All those discussions are going on regular internally to the Hospital Association and their members, as well as with us. And we'll continue to monitor that and make sure that we are letting people know as we need to the things and benchmarks we need to work with the governor on to make sure that we meet his goal of maintaining the integrity of the hospital system. Thank you.
All right, thank you, Kelsey. Governor, I'll turn it back to you.
Well, I wish that everybody that's tuning in and watching, and especially the good folks from the media and everything, you know, that they can really pay really close attention to the tone of the voice of General Hoyer, you know, the concern on the face of Dr. Amjad and Dr. Marsh, Bill Crouch, and myself. You know, I go back to just this, and I'll close with just this. Kathy, the First Lady, you know, when she was saying she was really concerned that people that knew they weren't vaccinated were just running up and talking with me and everything. And I said, Kathy, it's everywhere. And she really and truly felt like that, well, she knew it was everywhere, but not like the magnitude that is really out there, and there's no need for it to be everywhere. You know, without any question, you, right now, West Virginia, you've trusted me to tell you as best I possibly can the truth. Now, I want to just end with just this. Maybe we'll awaken tomorrow and the Delta variant will just be gone. Now, if you want to believe that, you can choose to do so. But absolutely, I don't want any part of mandating anything, you know, anything whatsoever. Mask, got to be vaccinated, whatever it may be. You know, I don't want to do that at all. I want you to have the choice on what to do, but I want to encourage you in every way and tell you the risk. The risks are absolutely right in front of you. Everybody that is speaking to you is telling you just how exposed you are right now. Just like I told the municipal leagues when I was there, I said, you can't imagine that if you're not vaccinated and you're sitting out there right now in all this crowd of all these people, and all of you, nobody has a mask on because everybody's eating, you can't imagine what a risk you're taking right now. You can't imagine if we go back to school and your kids aren't vaccinated, what a risk you're taking right now. It's a risk. It may just vanish and go away, but everybody that is an expert is telling you it isn't going to just vanish and go away. This thing has a real chance of getting worse. So, I would tell you, there's nothing in your life, there's nothing going on in your life if you're not vaccinated today. Nothing that's going on in your life that's as important as this is. And you right this second need to run to the fire and get vaccinated. And your kids need to run to the fire with you taking them, if need be, to get them vaccinated. Absolutely, I am telling you, as your governor, as your friend, as the person that you really trusted, right now, you need to put this as the number one priority in your life and run to the fire and get vaccinated. I can't say any more. I love you with all my soul. Kathy loves you with all of her soul. We want so much to just have goodness upon goodness upon goodness for West Virginians, for this incredible country, but especially for this unbelievable state. And you've done so good. Right now, nothing is as important as this. Nothing. Absolutely, you've got to run to the fire today. Thank you a bunch.
I'm Dr. Kara Willenberg, a physician and chief of infectious diseases at Marshall Health. You might be wondering, how do COVID mRNA vaccines such as the Pfizer and Moderna vaccines work? First, let's start with the ingredients. The mRNA vaccines are made of sugars, salts, lipids, and mRNA. The mRNA, or messenger RNA, tells our body how to make proteins. The COVID-19 mRNA vaccines teach our cells how to make copies of a spike protein that resembles the spike on the outside of the virus. Once our bodies create that spike protein, our immune systems are able to make antibodies. Antibodies can then recognize the virus if we come into contact with it and fight it off. The mRNA from the vaccine does not enter our cells where DNA is made, so it cannot affect our DNA. The mRNA breaks down and goes away quickly, leaving in its place the blueprint for protection. The COVID-19 vaccines boost our natural defenses against the virus. It takes our bodies about 2 weeks after the second dose of the mRNA vaccine to develop maximum protection. You cannot get COVID-19 from the vaccination. By choosing to get vaccinated, you are teaching your body how to defend itself from COVID-19. Vaccination is the safest path toward building a community of immunity. Thanks for tuning in. I'm Dr. Kara Willenberg, and I recommend COVID-19 vaccination to my patients, my family, and my friends. For more information about COVID-19 vaccines or to find a vaccination location near you, visit Vaccinate.wv.gov.